Welcome to Soul Wellness with Kristen, where we get into the nitty-gritty of various holistic modalities and explore exactly how they help you heal. I'm your host, Kristen, and I invite you to join me on this enlightening expedition where we explore the connection between mind, body, and spirit. In each episode, we'll talk in depth with holistic providers, medical professionals, therapists, and healers. Our goal is to empower you with knowledge, inspire you with stories of resilience, and provide practical tools that you can integrate into your daily life. So, find a comfortable space and join us as we explore the multifaceted world of holistic wellness. Get ready to learn how to improve every aspect of your life and simply feel good. The adventure begins now. Thank you for joining us. Today I have Liz Skalsky with me, who is a nurse practitioner with OVA Women's Healthcare. She is an integrative gynecologist, and I'm super excited to have some great conversations with you, so welcome.
Thank you so much for having me.
This is going to be awesome because you are such a great resource for those of us learning about hormone replacement therapy and all that goes along with that. Tell me how long you've been in integrative gynecology.
About 12 years, I would say, is the time frame. I worked in a outpatient GYN office for the last 10 or so years, and it was a regular office setting, so it wasn't functional medicine or integrative, but I definitely tried to weave that in, to my care in the traditional medical model. But, the traditional medical model is a little broken and It doesn't provide the time that patients and clients need for education and just diving deep into these topics.
Yes.
So that was kind of what transitioned me out of modern medicine and kind of decided to say, hey, let's focus on women. Let's have 30 to 60 minute blocks of time so we can kind of really get to the core of symptoms and how we can best treat women.
Yes, and I firmly agree with that, especially with hormone replacement, because this is confusing, it's overwhelming, there's a lot of different avenues you can go, and I'm so happy to be sitting here talking to you because I guarantee I'm not the only person in that boat that feels very overwhelmed.
Yep.
And there's a lot of options, so you need someone that can talk you through all of that.
Exactly.
And everybody's an individual too.
And everyone responds differently to different treatment modalities, and it's not a one-stop shop. It's nuanced care.
Yes.
So you just have to do each woman individually and figure out what's going to be the best combination to make her feel her best.
Yeah, and I know I've just jumped right into hormone replacement. So you do that, you offer that.
Yes.
Tell me more about that. How do you go about that with someone?
So it is nuanced because every woman is different. Some people will definitely want to do more of a functional medicine approach, bioidentical. Some people are a little bit more open to just kind of whatever's out there. I'm open to it all.
Okay.
And I like to integrate it all. So I do like to use FDA-approved bioidentical hormone replacement therapy, but I'm also not afraid to say if we did the bioidentical route and it's not working, maybe we spin off to, something that's hormonal that may not be bioidentical, but is still FDA approved and safe.
Okay.
Couple that with supplements and lifestyle modifications and mindfulness and sexual health and, just the whole gamut. As women, we're complicated beings, and replacing the hormones is usually not enough to get women to feel their best. We have to be checking other labs, for anemia and thyroid dysfunction and how are they sleeping and, how's their relationship and their sexual health playing into all of it. So basically for hormone replacement therapy, it's nuanced. Each person's individualized care, and I like to use whatever modality that's safe.
Yes.
And let women decide what's going to be best for them.
So you have a new space here at Soul Wellness. I'm so pleased to have you in the house and helping people. You can do labs here, and when someone is on hormone replacement, you have to make sure you're checking their blood consistently.
Yes. There's a lot of misinformation out there with lab work. Do you need to get your hormones checked? Do you not? And it's hard because in perimenopause specifically, one day your hormones can be through the roof, and then the next day they're crashing back down to almost negative, right?
Yeah.
And these high ups and down peaks, women are very symptomatic, and we go check labs, and the lab work will say, you're normal. It's a normal range. And you're like, I'm not feeling normal.
Exactly.
So we don't base our treatment on lab work, but it helps guide us in maybe picking the different HRT options out there, or just kind of figuring out, do we think you're still in perimenopause, or you're kind of getting a little closer to menopause? And when we have you on the hormone replacement therapy, checking those labs to make sure you're optimal and not maybe overtreated is definitely, is what we want to aim for. So yes, we do check labs probably about every 3 to 6 months on average, I would say.
As far as the sexual health component, how do you address your patient's partner? Because I've heard, and this is just what I've heard from other medical providers, is that when you're treating one person and you're balancing one person and the other person isn't balanced, it can really throw off the synergy of the relationship.
Absolutely.
So how do you address that?
So, I think both partners have to feel safe, right? So, as a provider, providing a spot that, we're just here to have a conversation to kind of figure out what's going on and how we can help address, your concerns. So, inviting environment. We're here as friends.
Yeah.
Think of me as a friend. I'm here to try to help you figure out how you can be better together. And it's a difficult topic for, I think, women and men, that sexual health is not freely discussed.
Right.
And, still kind of shamed maybe in ways. The dirty South, right?
Yeah.
Like, we don't talk about sex. We don't do that.
Right.
No one does that. Really? Okay. So, just coming in with that approach of like, this is natural, this is normal, and being able to read people. Like, where are they in their relationship together? Does she feel safe to have him in this space right now? So it's nuanced again, but partners need to be pulled in because men and women don't know their own anatomy.
Right.
They don't know how to please each other. They don't feel safe on asking, certain things to, right? So trauma-informed care, making sure you're taking, into effect their past, and what they hope to get, from the counseling. So it's...
Yeah. And your body changes. When your hormones are jumping ship.
Right.
It's like...
Right.
My mind is still the same, but my body is different.
Most days, maybe. Although some days you're like, are you okay? I feel a little sluggish up there. Like, what was I just thinking?
Oh, heck yeah.
It'll come back. No. So, yeah, it is so wonderful to provide care that you can make couples feel better. You can make women feel better sexually about themselves. There's creams and different supplements and products we can, talk about to help with things that come up with aging, like vaginal dryness and painful intercourse. And, so the takeaway from this is for all women and partners out there is don't wait until the symptoms get too bad.
Exactly.
Start, once you're in this transition mode and you're starting to see some symptoms and, maybe sex is becoming, uncomfortable or painful, go find someone to talk to that isn't going to gaslight you and say, this is just part of the transition.
Right.
You don't have to accept that as an answer.
Hormones are a hot topic in the news right now because of the removal of the black box warning and I think it's great. I think it's great to see people talking about it. I'm starting to see more podcasts and more people talking about it in general, and I think it's great.
I think it's wonderful. You know, it's we've we've had a 20-year block of time where we've done a lot of disservice for women with the black box warnings and the fear, the misinterpretations of data that was skewed, and you know, that just kind of led to this complete overnight almost shutdown of women taking hormones, even vaginal estrogen, right? Simple little things like this. And you know, now we see the damage for a lot of people that has done. So, you know, I do commend that they are starting to say, like, you know, we made a mistake. We need to make sure that now we get this information out there so women can make that decision. Do they want hormone replacement therapy, or do they want to, you know, do other treatment modalities that aren't hormone, you know, replacement therapy, but there's still modes and treatments we can do for any woman out there.
I love that, and I think the key is everyone know that there are options. So when you are prescribed something or you're talking to your doctor, don't feel like you're getting a life sentence of prescription hormones or anything like that. There are options.
Absolutely.
And you need to feel comfortable.
You can do topical, you can do oral, you could do transdermal. You know, there's so many routes.
Yes.
You know, as far as, you know, safety, we do like to use a little bit more transdermal applications for HRT because they are safer slightly, as far as like it bypasses the liver when you wear a patch, so you know there's a little bit less risk with clotting and things like that. So bioidentical HRT patches are very safe.
Oh, that's great information.
Safe, yep.
Okay.
So I liked a little teaching tidbit here. Women are always so worried about this clot risk and bleeding risk with birth control or hormones. So for any of the women out there, if you've had pregnancies, if you've ever been pregnant, that state your body's in is the most coagulative state you could ever be in your life. Your estrogen's probably in the thousands.
Wow.
Crazy high, right? So we see some patients do have more clotting and bleeding issues in pregnancies because of those high levels of hormones. If you passed that test in your life and you've had a pregnancy and you did not have clotting and bleeding issues, the next tier down then is usually birth control for the clot risk. So your pregnancies, birth control, and HRT is even under the clot and stroke risk associated with the standard birth control pill.
Wow.
So super, super, super low.
Okay. That is great to know. That is great to know. Very good. Tell me some other things in your practice that you're really passionate about that you do.
So it's integrative gynecology, so it's full scope gynecology. I love the whole age gamut. I love my teens and, you know, my young girls and young women, you know, start teaching about their menstrual cycles, and there's a huge lack of education out there with women knowing their own cycles and hormones and, you know, different things like that. So I love adolescent healthcare. I love contraception. I love, you know, teaching, you know, how do you prevent STDs. I love now this new transition because I am a perimenopausal woman myself. So this new enlightenment for women in these perimenopausal years and menopause is super special to me. So I said I wanted to go back and specialize in that. So I'm a women's health nurse practitioner by training, and then I went and I got my North American Menopause Society certificate.
Wonderful.
So, yes.
Love that.
Yes. Yeah. But love, you know, all age women care, standard gynecology, your pap smears, your sexual health concerns, you know, just everything.
And you also have weight loss in there as well. Okay.
Yeah, so there's metabolic weight loss. So, you know, making sure your thyroid's optimized, you know, weight loss as far as treatment modalities can be as simple as, you know, lifestyle modifications and teaching these women you need to have so many grams of protein a day. You need to have so many, you know, grams of fiber. Teaching the basics, helping them track that stuff. But if that's not enough, and obviously exercise, you know, women have to be doing some strength training at least 2 to 3 days a week. It's so important to keep that muscle mass up.
Yeah, for your bones too.
Absolutely. And then if, we need to dabble in medications for weight loss assistance, we can definitely, do the full scope of medication assistance for weight loss as well.
Excellent. And tell me more about your practice. Is it anybody can see you? Is it a membership? Is it concierge medicine? Tell me about that.
So it is a membership model, and any age woman can come see me. Basically, we have 3 different tiers. Tier 1 is, maybe the patients that only need to be seen once or twice a year, already established, or already kind of cruising on their HRT replacements or weight loss. And then tier 2 and 3 is just a little bit more frequently. So maybe we start you on hormones and we need to see you every 8 to 12 weeks, and we're checking lab work. So tier 2 is really good for those patients that we're seeing every about 3 months. And tier 3 is all of what we've just discussed. And then on top of it, there is 6 sick visits a year, for like urinary tract infections and vaginal concerns or sexual concerns, as well as an annual and a pap smear. So it's really designed to let women pick how much care do they need. Are they needing to start from zero, and we got to get their weight, their thyroid, and their hormones all buttoned up? It's not going to be doable in 3 to 6 months. Right? I like to say that you didn't lose your hormones overnight. You didn't pack on the weight overnight.
That's a good point.
This is going to be a process, and it's going to take us, for those patients, 6 to 12 months to get things where we're feeling like we're rolling again.
Again, important to seek help before you are completely in the tank.
Completely in the tank. Yes. It's a little easier to dig out.
That makes perfect sense.
Yes.
So tell me, insurance. Do you take insurance?
At this time, we do not.
Okay.
In the future, that might change, but right now it is cash-based practice.
Okay.
And it ranges anywhere from like $175 to $299 a visit, depending on where you fall in that tier.
Okay.
And how much care you need.
Great. Okay, so let's circle back a little bit to perimenopause and menopause. Tell us more about what's going on in the body and how that affects everything.
Good question. So we know that this is when our female sex hormones start to decline. And typically in perimenopause, the first hormone that declines is progesterone. And progesterone is kind of like our calming hormone, our mood stabilizer hormone. Progesterone, when we give it in bioidentical form orally, it actually acts on the GABA receptors in the body, and that produces a calming effect. So natural progesterone, the same that our body makes, oral micronized progesterone, helps us sleep.
Okay.
And mood. So it's usually the key starting piece of HRT and perimenopause.
Okay.
We tend to typically start with some progesterone.
And I've heard it's very protective in other ways. Well, if it's helping you sleep, it's helping a lot of things.
Absolutely, because I think that's neglected, is sleep.
Yeah, for sure.
And if you're not sleeping, your cortisol levels are higher, the energy to focus, the energy to meal plan and work out and, have the time and mind space to be present with your partner. All of that is impacted if we're not sleeping.
Right.
So sleep is a huge key piece. As far as other hormone transitions in perimenopause and menopause, typically then the next hormone we start to see decline is your estrogen as you get closer to that menopausal shift. And the true textbook definition for menopause is 12 months, no menstrual cycle. Or if we're doing lab work for women that maybe have like a Mirena IUD and we really don't know what's going on with their cycles because they don't have any, or maybe they've had a hysterectomy, but they still have their ovaries, they're still going to go through a natural transition of menopause. That's where we rely a little bit more on blood work for those patients. And like we talked about before, that is nuanced. We are not going to base it specifically on what those labs tell us, but it's a little bit harder to pinpoint menopause in those populations that don't have periods regularly, right? And then the next hormone that declines is typically testosterone, which is the hormone that's, associated to libido and sex drive, and also plays into mood and energy and muscle mass.
Yeah, energy, right? Brain foggy.
Yes.
I mean, being clear,
yes.
feeling clear, wanting to go work out.
Absolutely. Wanting to, have a sex drive again,
yes.
And be intimate with your partner. So when we look at HRT, typically how I like to approach it for treatment is we do like a stack approach to hormones. We start with 1 or 2. When women have an intact uterus and they are in menopause, you have to have progesterone, because progesterone protects the uterus from not letting that lining get too thick in the uterus.
Okay.
Because in menopause, if we're just giving you your estrogen back, but your ovaries are like, yeah, we're tired, we don't know what to do, your body doesn't know to shed that lining that the estrogen is supplying again.
Oh boy, okay.
So that progesterone is that protective piece. It's going to make sure that uterine lining stays thin, and we don't possibly set patients up for endometrial cancer and things like that if they had unopposed estrogen.
Okay.
And perimenopause, interestingly, can start in the mid to late 30s.
That's what I've heard.
Right? So there's this span of time, even prior to menopause, that women are dealing with symptoms for like 10 years.
So what kind of symptom would somebody see in their 30s? Because I've well past my 30s, and I don't think I've noticed anything change in my 30s.
Some women will start to have some mood changes, worsening anxiety, depression, worsening PMS or PMDD symptoms prior to their menstrual cycles. Some women will start to get vaginal dryness and pain with intercourse. And as you progress into perimenopause, then your cycles will start to technically change a little bit too. So if you were that perfect 28-day cycle, so predictable for so many years, and now your periods are maybe getting closer together and they're getting heavier, menstrual cycle changes are a key transition in perimenopause. So most women will start to see some variation changes in their cycles. How long they last, how heavy the flow can be. Sometimes women will get heavier bleeding in perimenopause and prior to menopause, because we have these high estrogen levels one day and down to nothing the next day, and you can get these weird spikes that can actually make women ovulate a second time in a month. So when you hear people are walking around, I had 2 periods this month, this is why.
No thanks.
So it's a trying time, and it's a long span of time.
And because the lab work can show one thing one day and something else the other day. And when you go to your doctor, that lab, you're going one day.
Right.
And you won't go again for probably 6 months.
It's just one tiny little snippet of information we have, right? That's pretty inaccurate most of the time to give us a picture of what's going on, right?
Wow.
So, we really try to base care on what is that patient coming in with.
How are they feeling?
What are they feeling?
Yeah.
What are their concerns? Do we need to start with sleep? Do we need to start with, mood and energy and sex drive? Do we need to start with estrogen for like hot flashes and night sweats? So it's really all over the board, and it just really depends on what that patient's presenting with.
Yeah.
And
how they want to feel.
How they want to feel.
Absolutely.
And no one needs to suffer. It's not acceptable anymore to say it's a normal transition.
Right.
Suck it up.
I know.
There's nothing we can do in perimenopause because you're not in menopause. So many women are turned away from treatment in perimenopause because no one's been we haven't been using hormones for almost 20 years now. And now we have this 360 where we're going to start using them again, which is wonderful. But we need to educate patients, let them know their options, because there's many options out there for everyone. And even for women that cannot have hormones, maybe they have a history of blood clots or breast cancer, those populations are a little bit more difficult because they don't have the whole plethora of options that everyone without the risk has. But But there are still options. There's still non-hormonal options out there to treat, vasomotor symptoms in menopause. And vaginal estrogen is safe for every patient.
Yeah.
Breast cancer patients can use vaginal estrogen.
Yeah.
People that have had blood clots or they have a clotting factor, it does not go systemic. It only targets the tissues in the vagina. So there's options out there for everyone.
That is so important to know. Mm-hmm. So important to know.
Mm-hmm. And that's another thing. Like, women will come in with memory and they're like, I can't remember anything. Like, I feel like I'm literally losing my mind, or maybe am I getting dementia?
100%. Right? I came into Soul Wellness the other night and jumped on the computer, and it took me 20 minutes to figure out my username and password. And I'm not kidding. I really thought I was losing my mind. I'm like, what is happening? What is happening right now? Oh my God. So it's real.
It's real.
It's real.
It's real. It's real.
Yeah.
And there's not a quick fix for everything, right?
Yeah.
It just doesn't exist. Same with hormones. It's not a quick fix. We can throw a patch on you. We can do this, but you still have to do the work.
Yeah. You
have to be self-committed to yourself to eat healthy, to meal prep, to exercise, to sleep.
Yeah.
You have to really, this is the time in women's lives where it could be a pivotal turn for being in the best health of our lives.
Yeah.
Because now we have time to take care of ourselves. We've raised our kids, and we're becoming empty nesters. And so I want women to feel empowered that, hey, I don't need to age and just accept this.
Right.
We can actually, improve your health with a lot of these treatments.
I love the accountability factor too, though. They have to.
Absolutely.
I can tell personally, if I don't eat enough protein in a day, I'm going to drag. And I mean, almost feel like something is seriously wrong with me. And then I'll look back at what I ate and, oh my gosh, I did not eat enough protein. That's what was dragging me down. But I also have noticed that if I don't hit the gym regularly, and I mean almost every day, I'll take a couple days break, but it does something to my mind too.
Absolutely.
Like,
well, we know that it impacts
our
neurotransmitters and our feel-good centers in the brain, and helps with stress and cortisol management. So it's absolutely imperative that
it's that's a hard line. I have to go. I have to go to the gym, and I'm trying to get better at eating more protein. But it's good that you factor all of these things in and talk to your patients about this.
Yes, we're not going to just slap a Band-Aid on it.
Yeah.
We're not just going to throw some medicine at you and say, good luck.
Yeah.
It's kind of really trying to get to each little piece that, hey, we can fix this, but it's not going to work if you don't try to fix this, that, and the other. People are, it's difficult, you know, it's difficult. So many people have limitations out there financially.
True.
Maybe mentally, mood-wise, just to get to the spot that they can even get themselves to the gym, right?
I can see the cycle, because when your hormones are in the tank, you have no motivation.
It's hard to get out of the house. You may not even want to deal with people anymore, right?
Exactly.
Right?
And you may not have the motivation to find a practitioner like yourself that's going to really listen and say, no. You can feel better. You can actually feel fantastic in your 50s. You can feel like dynamite.
Right.
But
you have to.
But you're going to have to.
You're going to have to put the work into. Yes. Absolutely.
Yeah.
And we have, this is going to spin off somewhere else, but it does tie in here. Like, what we eat, the food, that we're exposed to, the toxins, in our environment, all this stuff adds up for health.
It does.
For everyone. So education is so important.
It is. I've said it on this podcast a million times. When your gut is off, it throws everything off.
Yep.
It'll throw your hormones off.
It'll throw off your neurotransmitters. We know that people with gut issues have more issues with anxiety and depression.
Yeah,
we know that. It's been proven. You have to take care of your gut. We have to quit eating processed food. But the incentives aren't out there for people to have access to healthy food, which is so difficult. But education, just trying to really help figure out how we can help people eat, help we can help you exercise and weight train. And like, even when they don't have access to it financially, there's ways you can do this. You can get some, things in your home where you're doing like light resistance or, just using your own weight.
Absolutely.
For weight resistance training.
Yep.
So yeah, there's lots of options out there.
Absolutely. This has been awesome.
It's been wonderful.
Is there anything else that you want to cover? I want you to talk about how to find you, give us your website, what's the best way to contact you. You also do a free, discovery call?
Discovery call.
Okay.
So the website is ovawomenshealthcare.com, and my office is located in Soul Wellness. And if you go online, you can book that discovery call appointment and see, if OVA is a good fit for you, and we can kind of discuss what are your key concerns. How are we going to make you healthier?
Perfect.
And we'll take it from there. Every woman's different, and each person requires their own individualized care, and that's what I'm here for.
I love that. I feel like you help bridge that gap, because hormone replacement is overwhelming. And there's a lot of different avenues.
So many different avenues.
And it's good that you are walking that path yourself as a woman. And so you fully understand.
Absolutely. I do. Yep.
Yeah.
So don't suffer.
Don't suffer.
Don't suffer. Get out there and let's keep talking about this, because we have a movement going. Let's keep it going.
Yeah, absolutely. Thank you so much for taking the time to sit with me. I really appreciate it.
Absolutely. Thanks.
Thank you for joining us on another enriching episode of Soul Wellness with Kristen. We hope the insights shared today have resonated with you, inspiring a deeper connection to your own journey towards holistic well-being. If you enjoyed today's episode, we invite you to subscribe, share, and reach out. Your feedback fuels our mission to bring you meaningful content that educates, empowers, and uplifts. Remember, you are a vital part of this community, and together we're creating a ripple effect of positive change.